So, welcome to the February general meeting. Happy Valentine's, one day late. Hope y'all had a good day if y'all do anything special. As I've said, if you've not already done so, please sign into the chat with your name and agency so we can track attendance. Also, we ask that you turn your cameras on so that we can see your faces. We know there's a lot of Zoom fatigue, but seeing your faces makes virtual meetings so much easier because we feel like we're actually talking to people. And also just a reminder to keep yourselves muted unless you are actually speaking. So today we are bringing you 3 resources, what we think are new resources to you. So I just want to remind everybody that if you know of any agencies or if you yourself have worked with or are currently working with any other agencies that provide these same services that we're introducing to you today, please put those in the chat so that everyone has access to them. You know, it never hurts to have more than one resource for the same type of service. And we're all our own best resources because we know what we need to get to work with our clients and get them where they need to be. So we're going to jump right in. Our first speaker today is Justin Quick from Tarrant County Homeless Coalition, and he will be sharing information with us about the SOAR program. Justin has been SOAR certified since 2016. He has worked in 2 other states as a benefits coordinator, and most recently he has worked as a Presbyterian night shelter journey home guide. So Justin, it's all yours.
Hey, you guys. First time I've ever done this on Zoom before, so I hope it's working out well. My name is Justin Quick. I am the SOAR Disability Coordinator for Tarrant County Homeless Coalition. We started up this program back at the beginning of October to assist people with applying and pursuing Social Security disability benefits. I mean, that's pretty much it. So we are here to hold the client's or the resident's hand throughout the entire process. It is a long, drawn-out process. Social Security doesn't help with that either, so that's kind of why we're here. My other coworker, Laura Benitez, I believe is with a client right now, but she does outreach for our program as well. So we're not just meeting people at True Worth Place, we're also going out into the field if need be. There are a lot of variables within applying for Social Security disability benefits. So there's no one size fits all cookie cutter type thing. So I'll just kind of go over the process that we're doing. Really, it starts off with a referral from a client from you guys typically. We will do then an initial application for benefits. That will be done in person just because we do need to get wet ink signatures on a couple sheets of paper. So unfortunately, we can't do it all over the phone. But really, that's kind of the first step is just getting that initial application filled out and submitted. From there, the claim will go to the local field office for processing, and then it will be sent down to Austin, the Disability Determination Services in Austin, for the actual medical review. At this point, we essentially will get another couple packets in the mail to fill out with the client. We might also get what's called a consultative exam, where Social Security will contract with a doctor on the community to have an exam, a pinpoint exam done for physical or mental evaluations. We will drive people to those appointments if need be. I actually prefer to do that just because it is such an important piece to their claim for doctor's appointments that they schedule. If they miss one of those appointments, the claim is automatically denied and we have to start over from scratch or do an appeal. Kind of the next phase after going through DDS down in Austin is that it gets sent back up to the field office with a determination of approved or denied. If the claim is approved, great. It stops there. We get them their benefits, possibly a payee if Social Security decides on that. But if the claim is denied, then we go into what's called a reconsideration. The reconsideration is essentially just getting the claim sent back down to Austin for review again through a different set of eyes. If the claim is then denied again, then we go into what's called the appeal phase. At that point, I'm not an attorney. You do go in front of an administrative law judge, so I will hand cases off on a case by case basis, I guess, to an attorney in the community to handle it from there. That's pretty much it. I mean, there's a lot of variables and a lot of, I guess, situations that are unique to individuals. So I guess if anyone has any questions about our program, I guess let me know.
I have a question. I just received an email this morning. This is Lindsay, saying one of my people that I referred was not accepted. What does that mean? Does that mean they weren't accepted for to work with you, or they weren't accepted for the disability services?
So that in particular was probably due to a duplicate referral. So I went through this morning and kind of weeded out multiple referrals for the same person. Typically, the only other reason that I would deny them would be they already have benefits or they are working and therefore cannot reapply for benefits, or if they're working and making too much money, then they won't qualify for benefits as well. So if they're making over $1,300, roughly $1,300 a month, they do not qualify for disability benefits at this time. So usually those are kind of the two situations. Either they're already working or they already have benefits is why I would send out a denial.
Okay, hers might have been a duplicate because I had to update
I believe it was.
the phone number.
Yeah, if you got it this morning, I was going through and getting rid of duplicates. And that's another thing as well. We opened up a referral on ETO. I don't think the Continuum had used it for quite some time, but we are getting back into it now with our program here. You can actually see it on the left side where like your touch points and everything are. You'll see a referral tab in ETO, and you can click on that and essentially pick your client and send the referral over to the benefits team, and we'll go from there.
Justin, there's a question in the chat that says, how do we know when you see the person? Some residents don't remember or understand who they are seeing.
Yeah, we don't really have a good system outside of when the referral comes through and then we send out the accept, I guess, notification. That would be the only way that you would know that we met with them.
Justin, can I hop in here really quickly? There is a benefits touch point that is done whenever Justin or Laura meets with the client, and that can be viewed in the warehouse. It comes through under the assessments section. So you can look for that for your client in the warehouse, and it'll have a note about what they did.
Amber, do you have a question? Okay, Justin, there's another question in the chat. Can anyone utilize SOAR in their agency also?
Yeah, I mean, it's for the entire continuum. I'm not quite sure what you mean by that, but yeah, anyone that's in our continuum can send a referral to us. And we also do outreach. So if they're housed, I'll go to people's apartments. If they're unsheltered, we'll go meet them where they're at. So it's not just at True Worth Place, it's anywhere. Anywhere in Tarrant County for the most part.
Okay, there's another question. I have a client who is wanting an update. What is the best way to get an update from you?
Usually just an email, call, text. Things are running very slow at Social Security right now with COVID and everyone working from home. So updates are pretty much few and far between right now. But if there is a client that's getting anxious, feel free to reach out to me and I can call down to Social Security and just get a quick status update for you.
Okay, and I dropped Justin's email in the chat for you guys. All right, are there any other questions? Okay.
Yeah, I got one.
All right.
If someone has already applied for benefits, Justin, does it make any sense to refer them to you?
It kind of, once again, there's no clear-cut cookie cutter situation here. So it might be a situation where they have like SSDI only, but they need to get SSI added on to their benefit package. And so that would be a great situation where, yes, you'd want to send them over to me. And if you have any questions or concerns, I mean, just send the referral over. I'll hash it out with the client when I meet with them. Like yesterday, I talked with someone who was pretty young, had some mental health issues, but that we kind of came to the conclusion that they were more moderate and that they wouldn't impact her ability to work or sustain work. So even though the referral came through, we kind of sat down and chatted and decided that applying for disability was not her best option. It was better to kind of pursue employment at this time.
I've got a guy, maybe a couple of guys who have applied through a private agency, an attorney. Again, does it make sense to refer them to you, even though it doesn't seem like these attorneys are doing getting things done any quicker?
Yeah, so attorneys are a tricky situation, mainly because the attorneys get paid off the back pay of a client's disability claim. So they have no incentive to expedite the claim. They have no incentive to process it through the system quickly. They want to drag it out as long as they possibly can, get in front of a judge, which is usually 18 to 24 months after their initial application, because that's all the back pay that they're going to be getting there. So the system is set up to not really incentivize attorneys to act quickly for the client's case. Whereas us, we are the opposite. We don't get paid off the back pay, so we're trying to get them approved as quickly as possible. But when they are working with an attorney, our hands are kind of tied. We can't really assist them too much outside of just calling down to Social Security with the client and getting status updates if the attorney's office is not cooperating or responding in a timely fashion.
So if they're working with an attorney, they've got like an exclusive rights agreement or something with that attorney?
Yep.
Okay.
Yep. Essentially for that entire claim, if the claim gets denied, then it opens it up again to the client working with someone else. But while it's still in progress, there's not too much that we can do as far as assisting them outside of just calling Social Security with them and getting status updates. That's about it.
Okay. Again, I'm gonna be the devil's advocate. Can that claimant go in and tell SSI, say, hey, look, I'm not working with this attorney anymore.
Yep.
I want to work with Justin.
Yeah, they definitely can. You have to have the attorney, though, fill out what's called a withdrawal of representation form. And usually most attorneys aren't going to do that because that's where they make their money. So they're just going to hold on to the case as long as possible.
So the attorney has to agree to do this.
Yep, exactly.
Makes no sense.
And a lot of times as well, they will still be on the claim to receive the back pay money. So even if they are, if they withdraw from the claim and I start working on it, I do all the work and then they get paid. So.
Okay, we got one more question in the chat, Justin. Can you assist someone who has already applied with continuing application process or needs with appeal or needs assistance with appeal?
Yeah.
So if they've already applied, can you help?
Oh yeah, for sure. As long as they aren't working with an attorney, that's the big catch. If they just did it on their own, yeah, we can jump in at any time, help them with any step of the process.
All right. Thank you, Justin. I appreciate the information. I did put Justin's email in the chat. So if you guys have any other questions, you can either message him privately through the chat on this call, or you can just email him directly, and I'm sure he will be more than happy to answer your questions and work with you on whatever particular situations you may have. So I just kind of want to summarize and make sure that we got some basic information, Justin. So please jump in if I get something wrong. So they need to contact you if they are interested in services. And from what you said, it sounds like the referral form is an ETO. Is that correct?
Correct. Okay.
And the first step is to send you that referral form. You will review it and then determine if they're an appropriate fit for the program, whether that involves interviewing with the client or whatever.
Yeah, typically we won't turn someone down just based off the referral. I'll meet with them and have a chat before I jump the gun on that. So.
Okay, and you also said that clients can meet with you at True Worth, but you will also go to them, whether they're housed or in a camp or someplace Was that correct?
Yeah, I lost the back half of the audio there, but yeah, we will go out into the community. We will meet individuals in their home if need be, or at campsites. We prefer True Worth Place just as kind of a place to people to get used to, I guess, the idea of us being there as a place to go for benefits, but it's not necessary.
Okay. All right. Well, thank you very much, Justin. We appreciate the information. Okay, so next we have, let me find my notes. We have Nanda Remy and Deanna Mehefi, I'm sorry if I'm butchering y'all's names, from JPS. They are going to talk with us about the Bridge Clinic. Nanda is a registered nurse with 8 years of experience serving individuals identified with a substance use disorder. She is passionate advocate for harm reduction and trauma healing, and will begin a Master of Science in Nursing degree with the goal of becoming a psychiatric nurse practitioner. Deanna is a certified recovery peer. She has worked in addiction services for over 5 years and is currently working on her LPC to engage patients in care beyond initial medication assistance. So ladies, it's all yours.
Hi everybody. Nanda, you're still on mute, so I don't know if you knew that or not. Thank you.
Hello, everyone. So I think we had originally planned on doing kind of a PowerPoint, but that's okay. We can definitely work around that. We'll start by kind of talking about who we are. We actually, JPS was awarded a SAMHSA grant in 2020 with the goal of reducing opioid deaths. And so it's actually called the RTRT, or right treatment, right time grant. And from that, the Bridge program was started. And the Bridge program really helps people with opiate use disorder who would like to get off of opioids and have tried and been unsuccessful. So we started out receiving referrals from the emergency department. The emergency department being the psychiatric emergency center or the ED at JPS. They would be identified with an opiate use disorder or started on medication assisted treatment while in the emergency department if they were in withdrawal. At this point, we receive referrals from all over the place. So anyone in the community can refer to us, and we can help get that person the services that they need if they would like to be on medication to help them stop using opioids. So what we provide, like I said, we provide medication assisted treatment or medications for opiate use disorder. Specifically, we use buprenorphine, which is also referred to as Suboxone. Can you all hear the dog? I'm sorry about that. So basically, they get started on the buprenorphine, and they can get that in our emergency department. But now we are offering it as well in the urgent care center. The Bridge program sees patients Monday through Friday, 8 a.m. to 5 p.m. However, if it is outside of those times, the patient can always present to the emergency department if they are in withdrawal and immediately needing help, and they'll get send a referral to us. So we also provide, besides the medication and Narcan to anyone who needs it. In addition to Narcan for anybody who doesn't need it or just asks for it as a patient. And if you don't know what Narcan is, I'm sure most of you do, but it's the opioid overdose reversal drug. So we're trying to get as many of those out to the community as possible. We provide education on harm reduction to our patients and case management. Case management, meaning I specifically get them onto our caseload with the goal of getting them hooked up with a provider in the community that can continue their care. So a lot of our patients are now going to community health clinics through JPS for a specific X-waivered provider who can do all care for them, their primary care provider, basically, who provides the service. So we have successfully transferred a lot of patients, and it's been very, very successful. So we're very proud about that. We're a short-term grant, and with that goal, we get them transferred care. We are transferring care, like I said, to the community health clinic. We also have transferred care to MHMR of Tarrant County, and if they needed like a higher level of care. And we also have transferred care to the street medicine team through JPS or the MHMR homeless clinic. So we also provide peer services, and Deanna, I'll let you take over.
Hi, and Tracy, I just saw your message. It's good to see you too, even though I'm not really seeing you. So yeah, my part of it, Nina's really the medical, does most of the medical stuff. I am not educated in that area. So what I do is sort of the wraparound pieces. There's a biopsychosocial intake that's done at the beginning when they first present. And I use that and then go through their chart that's with JPS to see what services may be a benefit to them, along with, of course, asking if there's any specific services that they're in a special need of. Because this is a short-term program, I try to be sure that all that stuff is kind of in their hand before they leave us and move on to a community health clinic. But some of the wraparound services that we really look at are for those people that are unhoused, that they do and are aware of the shelters and what shelter policies are, so they're not showing up at 6 p.m, hoping to get a bed or something. We also, one of the things I do is try and set them up with supportive employment, particularly through Goodwill over off Circle Drive, and then, or off campus rather. I try to make sure that they've got all the information they could ever want on any mental health, self-disclosed mental health disorder, so that they have that in their hands. And then different things like questions on getting dental work done, questions on getting some other stuff done. It's just all those other pieces that kind of, crop up and need to be addressed almost immediately after getting the medication. We are low barrier. So there is, you would think there might be a little abuse, but we're really not seeing abuse of the system. We're seeing a lot of folks that are really just trying their dead level best to get okay again and to once again, be an active member of the community. So it's extremely rewarding. Once they move out into a clinic setting, it's also easier for the patient to go, to get there to and from. Usually Nina's really good about making sure that their clinic appointment is as close to their house as she can get them, so that transportation is not a hindrance. We did recently get some money approved for helping with transportation, because that is an obstacle for so many of the people that we see. And we want to be sure that we are removing obstacles as much and any barriers that we can, as much as we can. So
So I've added my email address and Deanna can add hers. So if you guys have any questions now, we can answer, but if you remember questions later, which I often do, you can definitely reach out to us. We are, like I said, located in the Urgent Care Center, which is in the main hospital of JPS. And we will provide RAC cards if anybody would like some. Also, the phone number that we have, I'll add it because the patient, if they have any questions, or the person that is interested in care, or if anyone has any questions, you guys can please reach out to us.
Yeah.
Okay, thank you, ladies. Are there any questions from the group? In the chat, somebody asked if you could list the transportation resources.
Sure. So what our clinic has been approved for so far, they're still working on getting us bus passes so that we can provide bus passes. But there has been an account set up for us, for those people that are in really, hard pressed need to set up to get them medical Uber, so that somebody can go pick them up and drop them back off. That's also helpful if they have warrants out or their vehicle's illegal. So maybe they have a vehicle, but it's not been legal in a year. And that does happen, where they'll be scared to drive their vehicle because it's not legal, or they have warrants out, so they're afraid to drive. So yeah, we've got the medical Uber set up now. I do know that Catholic Charities also has transportation services. I'm not entirely sure how those work, other than I know that they're available, and I know that they help people out getting to medical appointments, and I do refer people to them. And I was doing that mainly before we had this other stuff kind of set up for us. Does that help?
Okay, so there are a couple of other questions in the chat. One is, how do you send the referral? And the second one is, does the medical Uber cost the client anything?
No, medical Uber will not cost them anything. No,
Okay, and so can you
go ahead.
Can you go over the referral process again?
Well, anybody can refer. You can email or phone, or have the patient, the person that you're talking to, can call or email us. That's fine. They can also just present to the urgent care here in JPS, in the main part of the hospital, and let the nurses at triage know that they're here for the bridge program.
Okay.
So basically, they don't need an official referral. They can just, the person needing help can just call or show up to, the UCC or urgent care center or the emergency department if it's after hours. But if somebody would like to refer, then they can send us an email or call themselves.
Okay, and I see that you did put the UCC emergency department number in the chat, so y'all might want to jot that down so that you have that if you have any clients who might need this. Okay, are there any other questions about the bridge program or how that works or what it is for? Okay, I'm not seeing everything, but I'm got a small screen today. So y'all feel free to message the ladies privately, or you can email them or call the number and talk to them, and I'm sure they'll be happy to give you some more information. Thank y'all very much for sharing. That was something I was not aware of, and hopefully there were several people on here who also were not aware, and it's a new resource for them.
Thank you so much for allowing us to share today.
No problem. We're glad to have you.
Thank you.
I'm sorry.
I was just saying thank you. Thank you very much.
Okay.
Yeah.
All right. Okay, so next up, let me get back to my notes here. Okay, so our last speaker today is Jennifer Schnitzzius, and I probably butchered that name. I apologize, Jennifer. She is from the DFW Asylum Seeker Housing Network, or DASH Network. Jennifer is the Director of Operations at DFW Dash Network. She has a BA in Humanities and an MA in Philosophy. Her background is in management and ministry. Her key roles at DFW Dash Network include facilitating interviews with new applicants and managing their housing program. Now, we do have a little disclaimer for this. Dash Network services are not solely homeless services, but there seems to be some overlap. So we thought this might be some good information for you all. You may have some clients who maybe could benefit from Dash Network services and vice versa. So Jennifer, it's all yours.
Thank you. My name is Jennifer. I work for Dash, like she was saying. Dash provides services to asylum seekers only. And it seems like maybe there's not a clear connection between why I'm presenting here and where I work, but actually in the DFW area, there's an estimated 21,000 asylum seekers present. So I guess it'd be helpful to identify who is an asylum seeker versus some different kinds of migrants, and why do they need housing assistance when others may not. So the most important distinction, I think, is between asylum seeker and refugee. So both are a person who is unable or unwilling to return to his or her country because of persecution on the basis of race, religion, nationality, membership in a particular social group, or political opinion. So basically, a refugee or an asylum seeker is someone that is being persecuted on the basis of something that they either can't or shouldn't have to change. Refugees, on the one hand, tend to be evacuated in groups from their country or from a region of their country, and they're taken to a UN camp where they're processed, their asylum claim or their refugee claim is confirmed, and over a process of years, usually they eventually are placed into a country like the US, where they'll come in. If they're placed in the US, they'll have their transportation taken care of for them. They'll come in and be assigned a caseworker, have Social Security, work permit, certain benefits already given to them and ready for them that last for 6 to 8 months. An asylum seeker, on the other hand, although they're fleeing the same type of persecution, they're leaving individually or as a family. So they're leaving, they're having to use their resources to find their own transportation into the United States or whatever country they're trying to get to. A lot of people come in through the southern border. Some people are able to come on a visa into the US. So there's a lot of different ways you can enter the country as an asylum seeker. But when they get here, because they haven't already proven their asylum claim, they have to file their asylum claim in nation as an asylum seeker. So that's a really big distinction between asylum seekers and refugees, because they are not eligible for any services or a work permit while they're in the country, or any federal services. And most states also do not provide services, Texas being one of those states. Homelessness and food insecurity are two really big problems for this population. And that's why Dash was created. Our founder started Dash about 10 years ago, just out of her house when she started realizing that this was a problem. And we became a 501c3 about 5 years ago. And our current housing situation is basically, we have several apartment units that we rent out in the medical district of Fort Worth. That we place individuals and families into. And we also have host homes kind of across the Metroplex, where families open their door to asylum seekers. So generally, our residents stay in the program for about 2 years, which is the time that it takes on average for an asylum seeker to kind of go through the application process and receive a work permit. So again, during that whole 2-year span, they're not eligible for any government services. So if they don't have family or a friend that they're able to stay with during that time, which it's hard to find somebody that's willing to take them in for that expansive time, and especially if they come with a family. Yeah, this is what homelessness is, just a huge problem, or else they're forced to work illegally and jeopardize their asylum cases. So DASH provides housing through apartments and host homes. Like I was saying, we rely on a lot of food banks for grocery deliveries. We also have some partnerships with Kroger to be able to supplement and provide additional nutrition support for our residents. Besides that, we have a caseworker that can help them connect with other kind of resources that might be available to them, even though they don't have documentation or residency in the US. So like medical needs, mental health needs. And I'm thinking mainly the reason I wanted to share today was to kind of let you guys know how to identify an asylum seeker. Because a lot of times asylum seekers don't realize that's what they are. It's important that they realize that they're seeking asylum when they're here. A lot of times they'll think they're refugees, so that they know what benefits they might be able to access and what they need to do to get their case started, because they have to file for asylum within 12 months. So if you encounter somebody that's an individual or a family that maybe shares that they've been fleeing persecution in a different country, doesn't have documentation or like legal status here, that could be somebody that you could connect with me, and I can put my email in the chat here. And we could see if they would be eligible for DASH services or other services as might be applicable. So anyways, yeah, DASH provides housing and food support along with a few other services like ESL and job readiness while they're waiting for their work permit until they've had a work permit for 5 months to give them a chance to kind of save some money and find a place to go. So with that, I can open it up for questions. I know that was kind of a lot of information in just a short little bit of time. So
Are there any questions for Jennifer or about the DASH network?
Yes. Is there any restriction because of past criminal history or anything, Jennifer? I've got a guy that I think is perfect for DASH.
Okay. Well, we do rely on group housing. So what we have done in the past is just kind of ask for a reference, which maybe you could be for him, to say that he would be suitable for group housing, because we don't want to put other residents in jeopardy, obviously.
Yeah, this is an older gentleman, Cuban refugee. He does have some medical issues. He's been homeless a long time. He's qualified for permanent supported housing, but because of his legal status, he can't get it. He did have a social security card at one time, but it won't be renewed. And he says he's had enough work history to qualify for Social Security. Because of his legal status right now, we're having a difficult time housing him. Again, DASH sounds like a perfect venue for him.
Yeah, it could be. I just linked our application in the chat.
Okay.
So maybe if you could complete that for him, it would give me some more information and I could follow up on what resources might be available to him.
Okay. So you say you want me to complete the application? Because I doubt if you can complete it.
Hopefully they'll send me the recording.
So now, sir, I'm going to need you to come.
Okay, I see a couple of hands up. So Katie, I saw your hand up.
Actually, never mind. I apologize.
Okay, Tammy, I see your hand up.
Yes, thank you. I joined a little late, but we have a 65-year-old male who does not have residency status. He was living in an inoperable vehicle. He's blind and has health issues. We did not know of him. Apparently he went to Parkland for health issues and then went to a rehab facility, and the rehab facility kicked him out because he has no income. So we're paying for a motel room for him after finding him out in the cold in the vehicle again. But we don't really know where to start to help him because he doesn't have legal status or social security, and we just can't keep paying a motel forever. So could use some guidance on that.
Yeah, again, just to give me a little more information about his specific immigration background, if you could fill out the application on our website that I linked, that would be really helpful. Or you could just email me a few more specific details, or I can put my number in the chat also.
Thank you so much. This is like an answer to prayer.
Okay, any other questions for Jennifer about DASH or asylum seekers or clients that you have that may be in a situation?
Yes, ma'am. Hello.
Hello.
I heard something, but you're not coming through.
Am I clear?
I can hear you now.
Yeah, that's
Oh,
better.
okay. Hi, I'm Bakwi Sabor. I'm curious, you said you gave us the difference between refugee and asylum seeker. So from those refugee countries, would an individual who, I guess, escaped the country on their own be an asylum seeker if they
would be an
make it
asylum
with the
seeker.
group? Okay.
Yeah, so like, for example, right now, a lot of Afghans fleeing Afghanistan are being granted humanitarian parole, but some are having to flee individually because their lives are still in jeopardy, but they don't meet this qualification that the US and the UN are pulling people out. So they're having to leave on their own. They would be considered asylum seekers if they're able to make it into the US because they haven't already received their status upon entering the country.
Understood. All right. Thank you.
No problem.
Nathan, I see your hand up.
Yeah, thanks. I just want to remind folks that if you do have somebody who is undocumented or is a refugee or is an asylee, to please still continue to engage with them with coordinated entry in terms of completing a housing assessment and those sort of things. These folks still qualify for housing despite the fact that they may not be able to get an ID. Our programs that are nonprofits are still able to assist and house folks in our housing programs, even if they receive HUD funding because of their nonprofit status. So please keep that in mind and don't think just because somebody can't get an ID or they're not quote unquote a legal citizen or legal resident that they are automatically excluded from our housing resources here in the COC.
Thank you, Nathan. Justin?
Hey, and I just wanted to say as well, non-citizens can still qualify for SSDI and SSI benefits, depending on their specific situation. So just because they're non-citizens doesn't mean they cannot qualify for Social Security benefits.
Okay, thank you. So there is some overlap here and with homeless services, it sounds like. Very good. So if you all have any other questions for Jennifer, please call her or email her. It sounds like the way to get information to her is to complete the application through the link that she posted on the website. And Justin's posted another link on here for Social Security stuff. So if you need that, but please contact any of our speakers today if you have any further questions. anything that you need help with. If you're not sure if somebody qualifies for their services, always reach out to them and ask, because that's the way you find out if a particular person can benefit from those services. Any other questions before we move into announcements? Okay, I'm not seeing anything. So we do have several announcements today. The first one, I'm going to start with TCHC announcements. And our first one is from Marty Lawrence, our Director of Community Relations. And she wanted me to share with you that our community, Our Neighbors Portrait Project is currently going on. Laura Hunt is a local artist who generously took on the challenge of painting 26 portraits of people who were or had experienced homelessness over the past 2 years. This stunning exhibit makes the proactive connection between her art and the community issue of living without a place to call home. Laura's work as an artist focuses on themes of human relationships and emotions, social awareness, and empathy to tell a universal story. The original individual portraits rendered in a contemporary style using mixed media on 12 by 12 wood panels will be on display from February 18th through April 23rd at the Texas Wesleyan University Bernice Coulter Templeton Art Studio and Gallery located at 1415 East Vaughn Street. There is no charge for admission to the exhibit Monday through Thursday between 11 and 4. The original portraits will be on sale for $500 each. Our community, Our Neighbors posters, which are 18 by 24, designed by the artist, will be available for purchase at $100 each through the Homeless Coalition. All proceeds benefit the Homeless Coalition in our efforts to ensure everyone in our community has a place to call home and the resources to live their best life. So you can visit our website for more information. And in a few minutes, I will drop a couple of documents that she sent me into the chat for you to look at and copy if you want. So the next announcement, we need a big round of applause for everybody because you all have done great, marvelous, wonderful work on diversion. We want to congratulate all our partners for achieving a huge increase in diversions from 2020 to 2021. In 2020, we had 629 households diverted. That sounds like a pretty significant number to me. That increased to 926 households who did not enter into homelessness in 2021. That is a 47% increase in diversions. So yay, congratulations, and thank you all for your work doing diversions and trying to find other alternatives for people before they actually enter into the coordinated entry system and enter into homelessness. So yay, and congratulations to you all. Next, Nathan from TCHC has a couple of announcements and reminders that he would like to make. So Nathan.
Thanks, Jenny. I'll start off with the simple one and we'll get into the complex one here. So just want to remind folks that we are starting to do our trainings for our new housing assessment, the HAT, the housing assessment tool. For those of you who are subscribed to the case conferencing email invites, you'll notice that we've canceled case conferencing for February and March for not only permanent supportive housing, rapid rehousing, and veterans case conferencing, but also our outreach meetings, our emergency shelter case conferencings, and our youth case conferencings to allow ample time for everyone in the continuum to register for our trainings and take the housing assessment training. Our first training is tomorrow on the 16th. So please register for those trainings by clicking on the links that are provided in the case conferencing emails that I've sent out. For those of you who are working within our COC, we're also will be sending out a newsletter here shortly from Coordinated Entry team with links to all the trainings for February and March. That includes trainings for Arlington service providers as well. So really encourage you to attend those trainings. We also have a Talent LMS online training for our HAT. And I just want to thank everybody for your hard work and who was involved in the work groups to create the housing assessment. This is something that our community has created and our community owns collectively. And we can change it and tweak it as we see fit to best suit the needs of the folks we serve. So really excited to move away from the VSBAT finally and move on to our housing assessment that was created by our community and our COC. So please keep that in mind. Let me know or let us know if you have any questions about the trainings that we're going to be having at our offices here at Tarrant County Homeless Coalition, and we'll be having the trainings in Arlington at the Arlington Housing Authority for those Arlington service providers. The second thing I wanted to just touch on was that listening to various service providers, I've been getting some issues reported to me, just a collective feeling of some providers feeling that TCHC and particularly our Coordinated Entry department is, I guess, how do I put this, is maybe being a big brother and trying to punish folks in Coordinated Entry who are not interacting in CAS appropriately, our housing matching software. And that is not our intention, here at TCHC and our Coordinated Entry department. We don't ever want to come down from high and wag our fingers at people and say, we don't never want to implicate that we're better than other folks or trying to push an agenda on all of the COC. We want to work together, and as a lead agency, it's our responsibility to listen to all of you in the COC and take your collective needs and wants and transform those into tangible changes and solutions to the problems that we see. So please understand that it's never our intention to make you feel frustrated or make you feel like we're telling you what to do in a negative sense when it comes to CAS matching and CAS compliance. We want to make sure that that our system runs smoothly and runs in a fair way where folks are respected and we can get people into housing as soon as possible. And so I understand that putting updates in CAS may feel like a chore, and putting notes in CAS may feel erroneous or not like a good use of your time. But this is a process that we as the lead agency implemented to do our very best to fast track housing for our folks and make sure that we're all on the same page on housing matches and housing progress and housing updates, making sure we can get folks housed in a timely manner. So there's not a back and forth, he said, she said about what's going on with the client. And CAS is the tool that we use to be transparent in regarding those housing matches. And we do make mistakes time from time here at TCHC, and we learn from those mistakes and do our very best to correct those as we move forward with this process. So all that being said, we want to work together and we want to be a part of this team that is Coordinated Entry, and we're not wanting to ever have folks feel like they can't come to us and communicate issues and concerns, because as a lead agency, it is our responsibility to listen to those and act upon those accordingly in a strategic manner where everybody feels included. So, all that being said, thank you for all your efforts, and if you have issues, please speak up and let us know. And then we want to hear those things so we can make the system better, and as we continue to work together. So thank you.